Hi, I'm Dr. Robert Segal, inventor of the DermaBlade. I am a Stanford-trained, board-certified dermatologist in Tucson, Arizona. I'm in private practice and have 30 years of clinical experience and on the faculty at the University of Arizona. Today we're going to show the use of the DermaBlade in action. One technique is going to be the leveling technique, where an elevated lesion is anesthetized and leveled. This gives a terrific specimen for pathology and heals very rapidly with minimal, if any, scar. The other technique that we'll show is saucerization. Here, a deeper specimen is taken, which gives a better specimen for pathology and is frequently used if the tissue in the dermis needs to be sampled. I'm going to biopsy this irritated seborrheic keratosis here. It's in a bad location on the clavicular skin, irritated by seat belts and clothes. I'm going to numb it with a shot of xylocaine with epinephrine, which has been buffered. So the onset of anesthesia is instant, and we'll use very little drug by injecting just around the edges, using a high intradermal technique to create a small wheal. And then we'll take the DermaBlade, which is an amazing tool, and we stabilize the skin around it. And I don't want to make a deep cut here, so I'm not going to flex it very much. I'm just going to flex it a little bit to get a good grip. And then, using a rocking motion back and forth, we just level it off, try and get it more or less at skin level. And that is gone. And then, just with a little bit of aluminum chloride, that should heal with hardly any trace. We're going to demonstrate the use of DermaBlade to biopsy a irritated keratosis that may be a squamous cell, maybe a seborrheic keratosis. It's got a little bloody crust around it. So I'll clean it with alcohol and a gauze, numb this up with a tiny shot of xylocaine with epinephrine that's been buffered. That'll give instant anesthesia with that high intradermal technique to raise a wheal. And then the DermaBlade here is sterile for one-time use. And then we take the DermaBlade between the thumb and the forefinger, bending it a little bit, and then the skin is stabilized here. The lesion is removed by advancing into the lesion with a rocking motion, angling down, and then angling up. And that removes it right away, leaving a clean saucer-shaped base, which is treated with a styptic, such as 50% aluminum chloride. If there's any residual bleeding points, then those are lightly treated with the electrodesiccator, and the specimen goes to the laboratory. With this in mind, it's my opinion that the DermaBlade is the very best tool for you and your patient when the time comes to take a skin biopsy.